Good afternoon, good evening everybody. I'm Rory Holliday, I'm a physiotherapist, and today I'm going to show you some exercises for mobilising your thoracic spine. That's the bit of spine between your neck and the top of your lower back, and I suppose all the ribs that are attached to it as well. So quite often I see patients that spend long periods of time sitting at work. They tend to get a little bit rounded over again in the back, and when they've been there for a long time, it's difficult to straighten that out. And also when we're in that flex position, it's difficult to rotate well. So we get problems in that part of the back, and we also have a bit of a limitation to how far we can move the shoulders. So it may not be symptoms in the back that you're complaining of, it might be the shoulder that you're complaining of or the neck. And a lot of that can be coming from lack of mobility in this bit in the back. So I'm going to show you some quite basic exercises. Now, I've found over the years that we have to be quite gentle to begin with this part of your back. It's quite sensitive. Even if you don't have any symptoms here, starting to do some exercises can make it feel a bit bruised and a bit tender. So we'll start with something quite easy today. I'm going to be using a few pieces of equipment. You don't need much. We've got a rolled up towel, bath towel. If you have one, a long foam roller. And then for a little bit later, we're going to be using a gym ball, and if you haven't got a gym ball, we're going to be using a chair. Okay, so we're going to start off with a towel. I want you to take your bath towel, get the oldest non-fluffy one from the back of the airing cupboard, the one that you haven't used in years. That's going to be the one that you're going to use, and you're going to roll it up like you're going swimming, nice and tight, and you can even put some tape around it or hair bubbles or elastic bands around it to keep it in place. You're also going to need a cushion. I've only got a cushion off the sofa, but you might need one or even two cushions off your bed for this one, particularly if you're quite rounded with the head forward. A couple of pillows is a good idea. So I'm going to lay this down on my mat right in the middle, and I'm going to be positioning this so that my back lays with my head on the pillow, neck in between the pillow and the roll, and then the middle of my back, my thoracic spine is going to lay on that towel. Okay, let me get that in position, and we have to position it so that it's dead on the spine, not to one side. We're going to sit around on your mat. The bottom of the towel does not want to extend too low into the lower back. So feel where the bottom of the rib cage is. That's roughly where we want to be with the bottom of the towel. We're going to lower ourselves slowly onto that, and then we can let our head rest on the pillow. Now, if you rest your head back and you feel like your chin is poking up towards the ceiling, it means you haven't got enough pillow, so go and get another one if that's the case. If you can keep your chin rested in towards your throat, and you can lay in this position with knees bent, comfortably and relaxed, that's all we have to do. Call it the easiest exercise in the world, because you really have to do nothing other than breathe once you're in this position. So I'd normally say to people, begin with about 5 minutes at a time, once a day. Try and relax, not watching TV, not flicking through your phone or reading a book. Take it as genuine time to relax and just breathe gently into that, building up towards 10 minutes. Okay, whilst we're here, if you feel this is quite comfortable, you've done it for a few days running and you're happy there's no problems with it, we can just make it a little bit more of a stretch by bringing those arms up as far back as you can take them, and then gently back over. And as you do this movement, take care not to let the rib cage flare up towards the ceiling too much, so that you feel like this stays down as the arms go back. It might mean that the arms only go so far and then you bring them back over. And we're probably aiming for about 10 repetitions per minute for the 10 minutes that you lay here. Just nice and relaxed, and I'm breathing out as my arms go back, breathing in as they come back down. And if you encounter any shoulder pain as you take them back, next repetition, just don't go so far. Okay. So that's using the towel, that's quite straightforward. Using the roller, slightly more complicated, needs a little bit more balance if you've got one. Now, I'm not that tall, so I can sit on one of these and lie on one quite easily. If you're over 6 foot, you might have difficulty with this one. This is 90 centimetres long. I can sit on it at one end and have my head on it at the other. There's a little bit of a wobble, so you have to have your arms nice and wide so that you can relax into it and feel like you're stable. Feet nice and wide so that you're stable. And again, 10 minutes just resting and relaxing. If we start to bring the arms up with this one, we can still get a good stretch, but there's an added challenge because the roller wants to roll, so you've got to try and keep it nice and still, taking those arms up and over, and once again thinking rib cage stays down and still as the arms go back. Okay, so 10 minutes maximum, starting off with 5 minutes once a day. Nice and easy, that one. Okay, we're going to move on to something a little bit different now. So that was all to do with extending your spine, so the flattening out of your spine from this bent position. Now we're going to be asking your spine to rotate. A lot of rotation comes from the thoracic spine, so we need to make sure we've got that going as well. Now we're going to do an exercise called thread the needle. It's a bit of a yoga type exercise and it can be progressed up to quite a high level. I'm going to give you quite an easy basic one with a little bit of visualization to think about. I'll just move my mat back a little bit so you can see me a little easier. So I'm going to start off in 4-point kneeling. So I've got toes relaxed away, hips over knees, not behind them, over them, shoulders over hands, and I'm going to lift my chest up between the shoulder blades. I'm going to lift my hand. I'm going to imagine that I've got a plate of food in my hand, and I'm going to slide it through along the floor, trying to take my shoulder down as far as I can toward the floor, which means that this elbow, the supporting elbow, might need to bend a little bit to allow you to do that. And then bringing that plate of food back, I'm effectively going to drop the plate. I'm going to keep looking at my hand and I'm going to take it right up to the ceiling, high as I can go. See if I can get my arm vertical, and then I'm going to bring it back through, reaching under, threading the needle as it were, getting that shoulder down as far as I can get, and then bring it out, look at the hand, take it up toward the ceiling. And we might aim for, I don't know, maybe 6 to 10 repetitions on each side of this one, remembering to breathe with each repetition. And of course, with all exercises like this, we can do them on both sides. So I've got my plate of food, I'm going to reach it under, and take note, how far can you get with this one compared to the other side? I'm a little bit stiffer going to the left and the right, so I feel like I can't get that arm quite so high. So that's a little bit of work for me to do. You might notice a similar difference between left and right. Okay, so that's thread the needle, 6 to 10 reps, maybe a couple of repetitions each side if you feel like you can manage that one. And remember, as you come through, we can get down so that shoulder's getting toward the floor as we slide that arm through toward the opposite side. Okay, lovely. Have a little bit of a breather for a moment. We're going to move on to something a little bit different now. Okay, now this is where, if you've got a ball, it'd be quite handy to dig it out. It doesn't have to be massive. The bigger the ball, the easier it is. The smaller the ball, the harder it is. So, see what you've got. If you haven't got a ball, don't worry. You can use a dining chair. We're going to use that in a moment just to show you an alternative. So, using the ball. I just call this a roll out. We're going to roll the ball out. This is why the ball is the sort of preferable piece of kit, because it makes the movement a bit smoother. I'm going to start off with my knees allow, with my bum sat on my heels, and I'm going to roll the ball out as far as I can. And then I'm just going to let my bum come away from my heels a little, and I'm going to let my head sit down and rest between my arms, trying to flatten the back between the shoulder blades. Now, if your shoulders don't like that movement, you might find having your hands a little bit wider on the ball opens it up a little bit and just makes it a little bit easier. And notice that my hands have come away, I'm resting on my forearms and wrists there, and then come back away. If you can keep your bum down towards your heels, then do. It will make it a deeper stretch. But if you don't like that position, get your bum away from your heels so that your knees are comfortable, roll out from there. That's still okay, but you might find it just puts a little bit more of a stretch on the shoulders. So see how you go with that one. See, do you prefer to be here or back into here? Doesn't really matter too much, and you'll feel a bit of a stretch in the shoulders there. We're going to have a few breaths in that position, and then we come back out. Take it back in, head goes down. Try not to look down between your knees, keep the chin tucked up in towards your throat. Hold that for a few breaths, come back out. We might repeat that over 10 times. Okay, nice and simple, as your shoulders allow. If it's comfortable, do more. If you don't like that one too much yet, make it a little bit easier, do less repetitions, don't hold it for as long. Now, if you don't have a ball, we can do something very similar using a chair. So I'm going to grab a chair, or better still, you could just use the edge of your sofa. So you could be on the living room floor, hands on the sofa. So I'm going to put my hands on the chair. Now, obviously the chair's not going to roll away, so I have to take myself back a little bit, and I have to keep working myself back until I feel like I can get into that stretch position. Okay, so I'm going to let my head go down between my arms, get a little bit of a stretch, and of course if I was on a sofa, I could have my hands nice and wide, so my shoulders will be a bit more comfortable with that one. Down into the stretch, hold that for a few breaths, trying to flatten that back between the shoulder blades. A few breaths in that position, come back up onto the knees, okay? Back into it, nice and gentle. Gentle stretch there. And then gently back out. Okay, one more repetition of that one. Flattening that back, deep breath, breathe it all out, and ease out. Okay, nice and easy. Now we're going to make life a little bit easier now, less stress on the shoulders, a little bit more rotation for the back, so a little bit more like threading the needle. Now I've got an exercise I've done before with you in Pilates, this one I call the archer, and basically we're going to be rotating the body, but we're going to pretend that we're doing archery whilst we do it. We can do this in sitting, we can do it in kneeling, we can do it in standing. I'm going to do it in kneeling first of all, I'm going to do it in high kneeling. So, I'm going to be up here, reasonably wide base of support at the knees, take the knees a little bit wider, put a pillow under the knees if you feel like you need some comfort under the knees, and we're going to have both hands out in front of us, almost as though we've got hold of a bow and an arrow, and effectively we're going to pull that bow. And as I pull that bow, I'm still looking forward at this hand here, still looking at the hand that holds the bow, but this hand has come to my chest, and my sternum, middle of my chest, is aiming away. I'm then going to let that come back into the middle, and I'm going to go the other way. So I'm still looking forwards, not letting my head go with the chest. The chest rotates out this way. I'm going to stay here. Lovely. Repeating that over. Now, I am allowing my pelvis to rotate a little bit. If I wanted to be really strict in this position, I'd try and keep my pelvis absolutely still. So I wouldn't allow my hips to do any movement, and I would feel the weight on my knees would stay pretty level. If I allow my hips to move, I feel myself sort of swaying around a little bit. Try and minimise that in this if you can. Okay. And then we're going to try it in standing. Come up into standing. And this one you can allow a little bit of hip movement because it will come in quite naturally. Hands out in front. Slowly rotate yourself, pulling that bow back. And now the pelvis is moving around there a little bit as well. Bring that back in. Take that back, opposite direction. Bring that back in, and we're just going to go for a few repetitions in each direction, allowing the pelvis to rotate here as well as the torso, breathing out as we pull the bow, breathing in as we let it come back in. One more on each side, and then we will be done. Okay, well done. Good work. Give those a go. Spend a little bit longer on each one. If any of them are uncomfortable, take it out of the package, out of the program, see how you get on with them. And I will be adding some slightly harder ones to this as we go forward. So get practicing those, and then if they're comfortable, look out for some of the progressions that I'll be putting online. Okay, speak to you soon. Have a good night. Bye-bye.